Hey everyone, this is Miss Davis. This is Sleep and Rest, Chapter 35. Going to be a quick lecture on this information. I'm sorry, my screen does this every time for some reason, so just bear with me a second here. Okay, now we can get started. Okay, sleep versus rest. So sleep is a cyclical occurring state of decreased motor activity where our body functions are going to slow, our metabolism goes down, so our body can conserve energy. Sleep is characterized by an altered consciousness. A sleeping person is not aware of the environment or what's going on around them. So with some people, an alarm clock, bright light, or other stimuli usually awaken you, but usually background noises and soft light do not. So rest is when sleep is not adequate. So at rest, the body's disturbed by all exterior stimuli, and sleep restores the body, but rest alone cannot do this. So you really have to have both of them together. So this was something that we found that we thought was funny. If you're working night shift, for sure, this is how you're going to kind of feel, because you get off balance. Especially when you go to sleep in the morning and you wake up in the afternoon and it's still the same day. That can get a little bit confusing for our night shift people. So benefits of sleep. So sleep helps to increase our mental performance. Some evidence suggests that sleep and dreaming may facilitate the storage of long-term memory. It helps to assist the brain in reorganizing and storing information. And older adults have an even greater need for sleep to protect against the natural cognitive function decline that comes with aging. Sleep also appears to reduce stress and anxiety. It improves our ability to cope and concentrate on activities. And more sleep also reduces the body's sensitivity to pain. Sleep, rest, and illness are interrelated. So illness and injury increase the need to sleep and at the same time make it difficult to sleep. In turn, lack of sleep increases the susceptibility to illness by compromising the immune system. So if I'm not sleeping well and I'm sick, then this is going to increase the likelihood that I can get sick because my immune system is more compromised. People who are ill or injured need more sleep than usual to restore energy needed for tissue repair and healing. However, they often have difficulty resting because of pain and other symptoms of their illness. So some terms to know. Circadian rhythm, that's a biorhythm based on the day-night pattern in a 24-hour cycle. That comes from a Latin word that means about, which is circa, and dies, meaning day, so once a day. A person's circadian rhythm is regulated by cells in the hypothalamus of the brainstem that respond to changing levels of light. Circadian rhythm also affects our overall level of functioning. For example, most people have a higher energy level in the daytime and less energy at night. However, some people are more alert and active in the morning, and others function at a higher level in the afternoon. Reticular activating system, or RAS. So these are reticular and cortical neurons. Let me try again. Reticular and cortical neurons are called the reticular activating system. Okay, so it's those two pieces. Neurotransmitters associated with sleep mechanisms, including catecholamines, acetylcholine, serotonin, histamine, and prostaglandins. L-tryptophan and adenosine promote feelings of sleepiness. And then we have stages of sleep. Non-REM sleep, or NREM sleep, is also known as slow wave sleep because it's characterized by the presence of delta waves. Non-REM is divided into 4 stages, each deeper than the one that precedes it. The parasympathetic branch of the autonomic nervous system becomes progressively more dominant during each stage of non-REM sleep. And during this phase, muscles relax, body temperature lowers, and heart rate, respirations, and blood pressure decrease. So then we move to REM sleep, which is rapid eye movement sleep. This is essential for mental and emotional restoration, and loss of REM sleep impairs memory and learning. So non-REM and REM sleep. So non-REM stage 1 is a transition between wakefulness and sleep. You're usually very groggy. You're relaxed, but you're aware of what's going on in the surroundings. You'll have some slow eye movement, and this accounts for about 5% of our total sleep. So non-REM stage 2 is a light sleep. This is where you're easily roused. Your vital signs decrease slightly. Your body processes start slowing down, and this accounts for about 50% of your sleep. Non-REM stage 3 and 4 is your deeper sleep. You're more difficult to arouse. This is where your parasympathetic nervous system is really guiding your vital signs and decrease them even more. This accounts for about 20 to 25 of your total sleep time. And then lastly, we have REM sleep. So this is that rapid eye movement. So high activity sleep with spontaneous awakenings, less restful than non-REM. Rapid eye movements. This is where you'll have dreams. This is REM sleep is very essential for mental and emotional restoration and accounts for about 25% of your sleep. So these are 2 different figures that we found from your book that discuss how many hours of sleep a day that are required for each age group, as well as a picture of the normal adult sleep cycle. So these sleep cycles are repeated 4 to 6 or more times a night. Each cycle lasts 90 to 100 minutes each. Your REM stage lasts from 20 to 60 minutes each cycle. Okay, so our knowledge check. Light sleep and slowing brain and body processes are associated with which stage of non-REM sleep? Non-REM 1, 2, 3, or REM sleep? So our answer is option 2, non-REM 2. These are the characteristics of a person in stage 2 of non-REM sleep. So there are some factors that affect our sleep. Our age, our lifestyle, such as physical activity, food and alcohol, medications, caffeine, our sleep habits are very important. Illnesses, environmental factors, temperature and humidity, noise and light, odors, and the comfort of the bedding. So just to talk about those a little bit more, one of the major factors in regulating sleep is the amount of light received through the eyes. So if it's very bright outside, maybe I'm a night shift worker, and I have to sleep during the day, it would be really good for those people to be able to purchase some blackout curtains, something to make the room darker so that they will sleep better. Also, intense emotion before bedtime can really interfere with rest and sleep. So, while we all like to try to avoid it, we should really work on avoiding really big discussions prior to going to bed, or something that may cause us anxiety, because that's going to affect how well we sleep. So then discussing a little bit more about each section here on the slide. So talking about age, newborns and young children experience prolonged REM sleep. Young adults spend about 25% of their sleep in REM sleep, where older adults typically enter REM sleep quicker and spend more time in this active phase of sleep. So those are things that are important. Remember that REM sleep is really important for your cognitive abilities and your memory. So discussing nicotine and caffeine, those are central nervous system stimulants, and they will interfere with sleep. Smokers tend to have more difficulty falling asleep and are more easily roused than non-smokers. People who stop smoking often experience temporary sleep disturbances during that withdrawal period. And caffeine blocks adenosine and thereby inhibits sleep. However, individuals vary greatly in their sensitivity to caffeine. Medication. So there's a lot of medications that people take that can cause sleepiness or sleeplessness. So they make them very sleepy or they don't allow them to sleep. Medications that induce sleep tend to increase the amount of sleep while decreasing the quality. So zolpidem, which is Ambien, promotes normal REM sleep, and it appears to influence the quality less than other hypnotics, so it doesn't seem to be as bad. Amphetamines, tranquilizers, and antidepressants reduce the amount of REM sleep. Barbiturates interfere with non-REM sleep. Opioids such as morphine suppress REM sleep and cause frequent waking. And beta blockers are reported to cause insomnia and nightmares. So all those medications can really cause problems when we're trying to sleep. Illness. So illness increases the need for rest and sleep. We talked about that earlier. At the same time, its associated mental and physical distress can cause sleep problems. Fear of the unknown becomes a big issue with these patients. Any kind of disease symptoms like fever, pain, nausea, respiratory problems, any of those things can interfere with sleep. And specific disease conditions like hyperthyroidism, Parkinson's, are all going to affect how well the patient sleeps. So this is just a one of those thinking activities. So what do you think that surgery would have on, what effect would surgery have on your patient's ability to sleep? So somewhere in this circle we have an illness or an injury with some pain, which is going to cause loss of sleep. Loss of sleep is going to cause difficulty coping with more loss of sleep, which is going to cause more susceptibility to illness, which can cause more illness and injury, and the cycle can continue. So we really have to kind of try to intervene when we can in this cycle for patients. Okay, so some common sleep disorders that we will see is insomnia, which is the inability to fall asleep, remain asleep, or go back to sleep. So it can be any of those. Insomnia may be transient or short term, that's less than a month, or chronic, which is longer than a month. People with insomnia usually report an insufficient quantity and quality of sleep and wake without feeling refreshed, even though they are often observed to sleep more than they perceive that they do. Then we have people with circadian disorders. So this is an abnormality in the sleep-wake cycle, and it can be caused by rapid time zone changes like jet lag, shift work, or a change in total sleep time from day to day. Symptoms include decreased vigilance, decreased ability to perform psychomotor tasks, short sleep episodes that the person's not aware of. People suffering from jet lag need several days to adjust that wake-sleep schedule. So some common sleep disorders, restless leg syndrome. So this is a disorder of the central nervous system. It's characterized by an uncontrollable movement of the legs while resting or before sleep starts, before it onsets. Tends to run in families. It can affect 5 to 15% of Americans. Children and young adults experience this condition, but it is especially common in older adults. It's sometimes associated with low levels of iron and use of some antidepressants. Then there's hypersomnia. So people with excessive daytime sleepiness doze, nap, or fall asleep at times and in situations when they need or wish to be awake and alert. The sleep disorder that commonly causes hypersomnia are obstructive sleep apnea and narcolepsy. So narcolepsy we'll talk about, and sleep apnea in just a second. Hypersomnia may also be caused by disorders of the central nervous system, kidney, liver, or by metabolic disorders like diabetic acidosis and hypothyroidism. And it can also be a symptom of depression. So a couple other common sleep disorders. Sleep apnea, so that's where these patients have a interruption in breathing during sleep, so they are not getting any air in through the nose or mouth while they're sleeping. Typically the soft tissue of the pharynx and soft palate collapse and obstruct the airway. These episodes can occur several or 100 times a night and may last as long as 1 minute or longer. During these periods of apnea, the oxygen level in the blood drops and the CO2 level rises, causing the person to wake up. This may also result in cardiac dysrhythmias and increase in pulse and blood pressure. So those are those patients that you see that have to use the BiPAP at night. They have the machine that they need to use in order to sleep well. Then we have narcolepsy. This is a chronic disorder caused by the brain's inability to regulate sleep-wake cycles normally. The distinction between being asleep and being awake is very blurred. At various times, a person with narcolepsy experiences sudden, uncontrollable urge to sleep, lasting from seconds to minutes, even though the person sleeps well at night. They cannot avoid the sleep episodes, but they do awaken very easily. Narcolepsy is characterized by sleepiness, slurred speech, slackening of the facial muscles, a feeling of impending weakness of the knees, paralysis, and hallucinations. Their performance is impaired during these sleep episodes, and they can come on suddenly even while the person is having a conversation. So this next slide kind of talks a little bit more about narcolepsy and all the different things that can happen with the patient. I can say that I worked with a nurse that had narcolepsy when I very first started in nursing. She was actually my preceptor, a wonderful nurse, but we did work night shift, and she would frequently fall asleep, as this picture says, in random places. So she would be charting and fall asleep while she was charting. This was when we were still doing paper charting. And when she would wake up, she had written all kinds of interesting things in the chart. She also lived in Gainesville, and we worked here in Lake City, so she would frequently have to pull over on the side of the interstate of 75 because she was falling asleep while she was driving. And she'd wake up to the highway patrol tapping on her window, and it'd be 3 o'clock in the afternoon. So she very much had this disruption in her sleep, and it caused her to have this weird kind of falling asleep while doing other activities. So some common sleep disorders is what we're going to talk about next. Parasomnias, these are patterns of waking behavior that appear during sleep. So what happens with these patients is they wake up for one of these reasons. Sometimes they realize it, sometimes they don't. So first we're going to talk about sleepwalking and talking. So this occurs during stage 3 and 4 of non-REM sleep, usually 1 to 2 hours after the person falls asleep. The sleeper leaves the bed and walks about with little awareness of surroundings. He or she may perform what appear to be conscious motor activities like brushing their teeth or making coffee, but the person does not wake up. They're not aware of sleepwalking and has no memory of the event on waking. So I can say my grandmother is a huge sleepwalker. She would frequently walk around the house or go into their walk-in closet and couldn't figure out how to get out because she was still asleep. So that is something that you have to watch. I know a lot of people who are taking Ambien, Zolpidem to help with sleep. They had a lot of them that were having issues with getting up at night and fixing meals, and they would eat and not even realize it, so then they were gaining weight and didn't know why. So those are things that we need to watch for. Okay, so our next parasomnia is bruxism. This is grinding and clenching of the teeth. It usually occurs during stage 2 of non-REM sleep. It can eventually erode tooth enamel and loosen the teeth. The noise can also disturb whoever else is sleeping in the bed with you. Night terrors. These are sudden arousals in which the person, usually a child, is physically active, often hallucinatory, and expresses a strong emotion such as terror. Children experiencing night terrors typically cry or scream in fear, thrash about, and resist all attempts by their parent or other caregiver to hold or console them. The child appears to be fully awake, but he or she is not. In fact, the children in the midst of night terrors are extremely difficult to waken. These episodes may last from 10 to 30 minutes. The child typically returns to sleep without awakening and in the morning has no memory of the event. Okay, our last one we're going to talk about is enuresis, which is nighttime incontinence past the stage at which toilet training has been well established, so it's wetting the bed. It has incorrectly been associated with dreaming. Most incidents occur during non-REM sleep during the first third of the night when the child is difficult to rouse. So some safe, effective nursing care. You're caring for an older adult who has restless leg syndrome. What is restless leg syndrome, and how might you show care and compassion for the patient? So we talked a little bit about restless leg syndrome. It's a disorder of that nervous system characterized by uncontrollable movement of the legs. Sometimes they have an unpleasant creeping, crawly, itchy, tingling, or burning sensation in the legs, and it's only relieved by moving them or stretching them. The feeling tends to be worse in the evening and at night. Usually this runs in families and more commonly in older adults and women. Restless leg can make it really hard to fall asleep, and they may feel very tired the next day and sleepy. And sometimes this can cause depression or mood swings because of not getting enough sleep. So if this is severe and they're not able to sleep, they can put them on a neuroleptic agent. These are medications that we usually use to treat Parkinson's, so they're dopaminergics. People with severe symptoms may require some sort of anticonvulsant medication to control that sensation in the legs. As restless leg interferes with falling asleep, you will need to assess for insomnia or other indicators that suggest your patient should undergo a sleep study. And you may recommend that your patient consult a specialist in sleep or movement disorders. And then we, as a caring nurse, we want to be aware that this condition can affect the quality of life. We need to show compassion by empathizing with the unpleasantness of the symptoms and alterations in sleep. Some people report that other therapies help somewhat with this, like massage, acupressure, meditation, music therapy, cold or hot compresses. They also suggest that patient try to walk, massage, or stretch their legs before they go to bed. We want to encourage them to make lifestyle changes, because sometimes restless leg syndrome can be caused by caffeine, tobacco, or alcohol. Getting moderate exercise can help, and establishing a regular sleep pattern. And behavioral modification, including coping strategies, can help these patients with restless leg syndrome. Okay, so as the nurse, we're going to be caring for a hospitalized client who normally works the night shift. The client states, "I don't know what's wrong with me. I've been napping all day and can't seem to think clearly." The nurse's best response is, "You're sleep deprived, but that will resolve in a few days. You're experiencing hypersomnia, so it will be more important for you to walk in the hall more often. There's been a disruption in your circadian rhythm. What can I do to help you sleep better at night?" And lastly, I will notify the doctor and ask him to prescribe a hypnotic medication to help you sleep. So, some of those are really not what we would want to say to our patient. So we're going to go with answer 3. The data suggests that the patient's used to being awake at night and sleeping during the day, and so our routine has now disrupted their normal pattern. Okay, for which sleep disorder would the nurse most likely need to include safety measures in the client's plan of care? Snoring, enuresis, narcolepsy, or hypersomnia? So which one could cause a safety issue for our patients? So narcolepsy, because we don't know when these patients are going to fall asleep or what activity they will be involved in when they do fall asleep. So making sure that the patient is safe when they are out and about. Probably not driving a car down 75 is a good idea. Okay, so when we're assessing our patients, so we're going to assess the sleep patterns, rituals, the environment, aids, and sleep changes or problems. So we're going to talk about all that. It's important to assess usual sleep patterns and rituals for all patients who are being admitted to the hospital or seeking help for a sleep problem. A brief assessment for all patients should include questions about their usual sleep pattern, what their environment is like, what's their bedtime routine and ritual, do they take anything to help them sleep, or any kind of sleep changes or problems. A sleep diary is something that would be really helpful. So this provides specific information about the patient's sleep, wakefulness patterns over a certain period of time. It allows identification of trends in sleep wakefulness patterns and associates specific behaviors interfering with sleep. The diary is typically kept for 14 days. So that's something that we would ask the patient to do, and if they wake up, they just jot that down in their journal, and then when they come back, we can sit down and look at it and kind of come up with a trend. So one of our nursing diagnoses that we can use for sleep is readiness for enhanced sleep. Okay, it's important for us to determine whether lack of sleep is a problem, a symptom of a problem, or is contributing to or causing a problem for a different health problem. So some of our nursing interventions. So we could cluster or schedule nursing care to avoid interrupting their sleep. Unless the patient's critically ill, we should not wake them for morning vital signs if they're asleep. We want to create a restful environment. Many people find it difficult to sleep in an unfamiliar bed. Hospital beds are not noted for their luxury, but you can help them, make them more comfortable. Make sure the linens are tight on the bottom and loose on the top. Keep their linens clean and dry. Good body alignment helps relax the patient. Keep the room dark and quiet, and as much as possible, control the temperature of the room and provide good ventilation. We want to promote comfort, so if the patient's in, I'm so sorry, let me go back. Okay. Oh, that's not where I was. I apologize, I do this at least once during a video. Alright, we talked about environment. So promoting comfort. If they're in pain, itching, nauseous, all those things are going to keep them from sleeping. So we want to offer pain medicine at their scheduled times, especially before sleep times. And then try to offer fluids, cool cloths, a back rub, something to kind of help settle them down a little bit. And then we want to support bedtime rituals. So most people have some sort of a routine for before bed. Some people like to read or watch TV. Maybe I drink warm milk, or I pray or meditate. So try to provide those things for them. If it's a child, usually they have something that they like to go to bed with, a doll, a blanket, a bedtime story, something that would help. We want to try to include any routines or rituals as much as possible. And we want to advise patients who smoke not to smoke after their evening meal. Okay, a few more nursing interventions. So we want to maintain the safety of the client, offer foods that help promote sleep, teach about sleep hygiene, and administer complete client teaching about sleep-inducing medications, because we really need them to understand how to take these medications if they're taking something every night to help them sleep. Okay, so you're a nurse caring for a patient in the ICU who is awakened hourly for neuro checks and vital signs. With the around-the-clock interruptions and rest and sleep, what problems might you expect your patient to develop? Alright, so some of the things that can develop from lack of sleep is they have an increased risk for stroke. This makes their pain sensitivity really high. It can reduce insulin resistance, which can lead to type 2 diabetes. They can have headaches. They may be more susceptible to infections, like we talked about with their immune system. Their stamina and physical endurance is going to be decreased. They can have GI distress, poor appetite. They can have reduced concentration, increased distractibility, and poor judgment. They can have confusion and have a lot of daytime sleepiness. So this is a picture of what's called ICU delirium. So you can see in the bottom picture the patient's lying in the bed and all these weird things are happening. It's from not getting that sleep, being on medications I'm not used to, having people constantly coming in, so I may not be aware of what's going on. Typically these patients, once they are moved out of this situation and into a more normal one, things sort of resolve. Now that's different sometimes in some of our really elderly adults, but typically a younger adult, middle-aged adult will recover from that delirium once they're out of that situation and they get a regular routine sleep. That is it for me. If you have any questions, please give me an email, melissa.davis@fgc.edu. Thank you.